Sexually transmitted diseases. Fun fact that is not so fun. One of the 25 people globally that have a sexually transmitted disease or infection. According to the World Health Organization, over 1 million new cases of curable sexually transmitted infections are recorded every day worldwide in people ages 15 to 49. So, what is STD or STI? Sexually transmitted disease. They are spread mainly by sexual contact. STIs are caused by bacteria, viruses, or parasites. A sexually transmitted infection may pass from person to person in blood, semen, or vaginal and other bodily fluids. An infection can only be transmitted through any type of sexual activity. Types of sexual intercourses STDs can be transmitted to are vaginal intercourse, oral sex, anal sex, and manual sex. For most common sexually transmitted disease. First, we have chlamydia. Chlamydia is a common sexually transmitted infection that can occur in both men and women. It is caused by a bacterium called Chlamydia trachomatis. If not treated, chlamydia can cause serious problems, including infertility and ectopic pregnancy. In pregnant women, it can cause the baby to be born early. Genital herpes is a herpes infection of the genitals caused by the herpes simplex virus. Most people either have no or mild symptoms and thus do not know if they are infected. When symptoms do occur, they typically include small blisters that break open to form painful ulcers. Gonorrhea is a common sexually transmitted infection caused by a type of bacteria. It usually spreads through vaginal, oral, and anal sex. Gonorrhea causes different symptoms in women and men. Women often feel no symptoms, but untreated infection can lead to infertility and problems during pregnancy. Common symptoms in men include pain or burning when urinating, discharge from the penis, and sometimes pain in the testes. Gonorrhea can be passed from a pregnant mother to her baby. Syphilis is a preventable and curable bacterial sexually transmitted infection. If untreated, it can cause serious health issues. Many people with syphilis do not have symptoms or do not notice them. Syphilis is transmitted during oral, vaginal, and anal sex, in pregnancy, and through blood transfusion. Syphilis in pregnancy may lead to stillbirth, newborn deaths, and babies born with syphilis. Other diseases in the reproductive system. Epididymitis is a medical condition characterized by inflammation of the epididymis, a curved structure at the back of the testicle. Onset of pain is typically over a day or two. The pain may improve with raising the testicle. Prostate cancer is an uncontrolled growth of cells in prostate, a gland in the male reproductive system below the bladder. Abnormal growth of prostate tissue is usually detected through screening tests, typically blood tests that check for prostate-specific antigen levels. Male infertility refers to sexually mature males' inability to impregnate a fertile female. In humans, it accounts for 40 to 50% of infertility. It affects approximately 7% of all men. Male infertility is commonly due to deficiencies in the semen and semen quality. It is used as a surrogate measure of male fecundity. Cervical cancer is a cancer arising from the cervix or in any layer of the wall of the cervix. It is due to abnormal growth of cells that have the ability to invade or spread to any parts of the body. Early on, typically no symptoms are seen. Common diseases of the female reproductive system. Dysmenorrhea is a medical term for moderate to severe pain caused by menstrual periods. Primarily, dysmenorrhea may begin in 1 to 3 days before your period and last until 2 to 3 days after the onset of menstruation. It typically includes a collection of other symptoms such as nausea, vomiting, and fatigue. Amenorrhea is the absence of menstrual period in the female who has reached reproductive age. Physiological states of amenorrhea are seen, most commonly during pregnancy and lactation. Outside the reproductive years, there is absence of menses during childhood and after menopause. Oligomenorrhea is infrequent menstrual periods. Generally, the menstrual periods occurs at intervals of greater than 35 days, with less than 9 periods in a year, where previously there had been regularly established pattern. The period may be light or short in duration and irregular. Sterility. Female sterility or infertility is the inability to conceive after a year of trying. In females, the fallopian tubes are blocked, which can cause the failure of the ovaries to produce eggs. Vaginitis is inflammation of the vagina and vulva. Symptoms may include itching, burning, pain, discharge, and a bad smell. Certain types of vaginitis may result in complications during pregnancy. So how do we keep our reproductive system clean and healthy? For male reproductive system, to prevent hernias, men should be careful when lifting heavy objects. It is important to thoroughly clean the external organs, the penis, and scrotum daily, preferably during a shower or bath. The groin area or the area of the external sexual organs should be protected during athletic activities by wearing a protector or supporter. Tight clothing should be avoided since tight trousers, jeans, or underwear can irritate or cause pain in the groin area. Tight jeans increase testicular problems. For the female reproductive system, during the menstrual period, cleanliness is especially important. Hormonal changes may cause the skin and hair to become oily and the body to perspire more heavily. Use mild soap to wash the external organs. When the menstrual flow mixes with air outside the body, it can develop a slight odor. It is important to change sanitary pads or tampons every few hours. Female hygiene, spray, deodorants, douches, and deodorant tampons are not necessary. In fact, they may be harmful because they may cover up the signs of an infection. If normal body odors are not eliminated through washing, it is important to seek medical attention. For athletic females, always wear protective clothing.